Hey there, how's it going everybody? I wanted to make a quick video on ultrasound for people who are either starting or thinking about starting their transition into this career. I had somebody ask me on Facebook a whole questionnaire, and I thought the questions were pretty good, and I thought I might answer those questions in a video that may help newcomers onto this field, which is very interesting. I love ultrasound. It has its ups and downs. It can be very taxing. Any career in healthcare has its ups and downs. It also has a potential for burnout, or maybe it's just any career has a potential for burnout. As long as you keep those things in mind and always try to keep it new by learning new things. It's very easy to get stuck in a rut if you work in a department where you only do these certain amount of exams. You never do anything new, never do anything out of the box. You know, anything in healthcare can become very monotonous. I'm pretty sure there's doctors out there, there's nurses out there that do the same thing every day in and day out. And they themselves see like, oh wow, this is extremely boring. This is not what I thought it would be. Whereas other people on the outside look at them and are like, wow, you have such an amazing profession. You work helping people, you heal people. But it's different when you're on the inside. So keeping things new, keeping things fresh, keeping an open mind are very helpful for, I think, any career, but especially those in healthcare. First question is, can you share a little bit about what initially attracted you to this field of work? So when I was about 18 years old to about 21, I was a barber. I liked being a barber. It helped me. I'm a very creative person, and I was able to, use my creative abilities in barbering. But like every other job, it got very monotonous doing the same thing over and over again. I felt like I had mastered at least what I was doing. I think anything you do, even if you master it, there's always more to learn. But as an 18 to 19-year-old, that's the mindset that I had pretty much done it all. And I got very bored and had always had an interest in medicine. So I was thinking of maybe considering a career in medicine to become a doctor. So I researched a lot. It took me a while. I eventually started school. I wanted to at least get a job in healthcare to see how I liked it. I didn't want to spend, 10 years in school to become a doctor and then be like, I don't want to do this, or I'm bored with this, or whatever, even if the pay is decent. And it's one of the professions that are very, it's an honorable profession. So I decided to take a course in cardiovascular technology. The course itself was very simple. It was about a year long. They taught you EKG. They taught you how to do Holter monitors, EKG, stress tests, pretty much the basics of cardiovascular technology working in a lab, not echo. But what I liked about that program was that you had the ability to go into echocardiography. And that's where I thought I'd be more interested, because it was more in depth with the knowledge, pathophysiology and all that. So I did that. I did the cardiovascular course. I finished over a year, and then I started the echo course, and I started working at a hospital in Miami Beach doing EKGs. The job was very boring, though. It was not stimulating at all mentally. It was just literally just doing EKGs over and over and over, and day in and day out. It got real boring real fast. I did that for like a year. But then I started the echo course, but I saw myself hanging out with the people in the ultrasound courses more often and visiting the ultrasound labs more often, because I just felt like they were doing more, whereas we were focusing on the heart, which I liked a lot. I really did like the cardiology portion of it, but I felt like maybe I would be bored doing echocardiograms every day, as I was doing EKGs every day, even though an echocardiogram is leagues above an EKG. Anybody can do an EKG, really. There's nothing against echocardiographers. I think what they do is great. I know some fetal echocardiographers and pediatric echocardiographers that, they do an amazing job. So I thought I'd be bored with that. So I was like, you know what? I think I want to change. And that's when I made the change into pretty much general ultrasound, which at least in the school I went to, it was vascular, general, and OB. And I felt I had a broader range, and I was much more happier in those classes. I loved the OB stuff. I loved the vascular stuff because it kind of still kept me with the cardiovascular, which is what I liked, and the general stuff. So yeah, so that's pretty much what I did. I finished that, and then I started working, little jobs here and there in Coral Gables, Florida. Working at a small hospital, doing pretty much call only, working with mostly that hospital, dealt with the elder population. Every now and then we get, a young person for appendicitis or a young person for a first trimester OB scan, stuff like that. But I learned, a few things, and then from there I started working in West Palm Beach. But I think one of the further questions get into that. So that's question number one. Question number two. Can you tell me about the career path you took that led you to your current job, and what courses would help me prepare for this field? All right, so I kind of already told you the career path where I did the ultrasound, then I started working in the hospital. As for what courses you can take that can prepare you for this field, science courses are good because they can teach you analytical skills. Honestly, art courses are probably good. They can teach you, the creative skills that you may need for this job. Medical terminology, I think, is very important. We have our own language. Every profession, every hobby even has its own language that everybody pretty much within that hobby or profession speaks their own jargon. Same thing with medicine. You have to talk the talk before you can walk the walk. So I think early on, medical terminology courses will help a lot. Anatomy and physiology are a must. If you're a sonographer, you have to know your anatomy, especially cross-sectional anatomy. But before you get to cross-sectional, you have to know your regular anatomy. Question three, was there anything about the program that you feel didn't prepare you well for your first job that I should plan for? See, that's a very good question. When you're taking ultrasound courses, you're learning scanning. Us students, we're scanning each other. We're learning the anatomy from each other. Every now and then you'll have a student in the class that may have gallstones that they didn't even know about, so you kind of learn maybe a little pathology. I was lucky where I was at, they actually allowed women that were pregnant to come and sign a waiver, pay a fee, and we could scan them. So that was pretty cool as a student. I don't think, at least where I was, they really prepare you for the dealing with the people aspect. I think most places kind of think that that's inherent. You kind of learn that along the way. So maybe, at least in my school, I'm pretty sure there's many schools across the US and across the country and the world that are different. But maybe that aspect, the patient care aspect, we are taking images, we are doing, I believe it's a creative endeavor in healthcare. But we can't forget that we are dealing with people, and it's very easy to forget that fact when you're trying to get your great images, to forget that there's a person there that's in pain. Sometimes we as ourselves, if we ever end up sick, we're reminded, like, damn, we're the patient and this is how we want to be treated. So next question. Sorry, the camera died, so I had to return it on and everything. But can you tell me more about your day-to-day responsibilities and what a day in the life is like? All right, so I'm pretty sure a lot of sonographers like me can just say, do a ton of ultrasounds. And that's pretty much it. But, like any job, there's a lot of things that go into doing ultrasounds, dealing with people, not only patients. I work in pediatrics, so we have to deal with patients and their parents, but dealing with coworkers in the direct department, dealing with coworkers outside of your direct department in other radiology departments in nuclear medicine, x-ray, dealing with nurses, doctors, and other departments of the hospital, the ER. If you work in an outpatient center, it's pretty much the same thing. It's just like any job. You want to do a good job, you have to be able to deal with people. Unfortunately, tolerate some people. But pretty much a day in the life is you do each exam, you get the history, you get the ordering diagnosis, you have an idea of what they're looking for, hopefully, and then you begin to search. You do your protocol, you do your exam, how it's supposed to be done, all these images in this order that you're used to doing, and hopefully you either find a normal exam or you find something that gives the person, the patient, and the doctor an answer as to why they're having these symptoms. And that's pretty much it. It's just like any job. The only difference is you can potentially give an answer to a person that might be having symptoms for a disease that they most certainly don't want, but at least they can maybe begin the journey to healing, be that, you know, medical or surgical. So that's pretty much the only difference. But you got to be ready to work with people. You got to be ready to think on your feet, think critically, think creatively. Being creative is, to me, in my opinion, is great for ultrasound. And just do your best job. Try to get the best images you can, both aesthetically and diagnostically. All right. So, what do you like most about your job? This is the next question. What do you like most about your job, and what is the most challenging part of your job? As I said, right now I work in pediatrics. So honestly, I think the most challenging part of my job is working with some babies that just cry when you do their exam and they're screaming, and there's a lot of motion artifact, and you're trying to get good images, but it's near impossible. And obviously, then you're dealing with the patient's parents. Many times, patients crying, parents are nervous, they're anxious because they think they're crying because of the exam. You try to explain to them that the ultrasound typically doesn't hurt unless if they have pain where you're scanning, but it's most likely not going to cause any harm or damage. So you're dealing with a crying patient and a very nervous and anxious parent. That can be quite stressful, sometimes more than others. What do I like about my job is just finding diagnoses. I know anybody who might not work in the medical field, they might say, oh wow, you get happy when you find a diagnosis. And it's not that we're happy, but that's literally our job. Our job is to find what's wrong. And that to me is the most important part of the job. Honestly, days where I find a lot of pathology, I prefer to days where I don't find any. You know, sometimes it can be sad because you know some of those diagnoses have very poor prognoses. But for the most part, like everything in life, there's a happy medium where most diseases are pretty treatable and, you know, occur with, you know, not too much suffering. So anybody that does ultrasound can relate to what I'm saying. You find pathologies and we share these pathologies with each other to educate each other, to teach each other, to learn from each other. And it's very important, in my opinion. All right. Next question. What's a typical entry-level position in this field? That question, I mean, there's not much to that question. Entry-level position is you go to ultrasound school, sonography school, you graduate, and you're a newbie sonographer. And you're just ready to learn. Scan and learn all the protocols. Once you got all the protocols in your department down, you'll learn. Watch other people, see how they do it, see how they find pathologies. Miss things and have people backscan you and find them. I remember when I first started out, I would do an ultrasound, super proud. I showed my guy and he's like, that's some nice pictures, but what's up with that pleural effusion right there? And I'd be like, oh my God, right in front of me. So that's pretty much the entry level position in this job. And we get a lot of patients and be like, oh, how long does ultrasound school take? And you tell them, and they're like, oh, that's it. Oh my God, it seems so easy. But ultrasound is a lot of learning. I've been doing this for 16, 17 years, and I still find things that I've never seen before. I still find myself going to the books, going to the journal articles, and going to Google. And that's what keeps it fresh. There's limitless amount of information to learn in medicine. All right. What educational or other experiences would best prepare someone for an entry-level position in this field? All right, so educational, I said it before, learning medical terminology, anatomy, pathophysiology. Those 3 classes are great starters for ultrasound. I think having a career in the services fields is good. Working in restaurants, working in hotels, just working with people that may not always be happy with their service, and learning how to deal with people, because you're going to be dealing with people that are sick. You know, they might not be happy. Most people are grateful. Most people respect healthcare workers, and they're very grateful for us. But some people come and they're just not too happy, or maybe they've been waiting to get their exam for a very long time. So working in the restaurant industry, the hospitality industry, I think is a good starter for any healthcare job, in my opinion. Okay? Next question. What are some future career advancement opportunities in this field after starting out in an entry-level position? All right, so I remember in the early 2000s, there was a lot of talk about this ultrasound practitioner category that they really wanted to roll out. I saw articles about it, and I was actually very interested in it. I was like, wow, that's right in my wheelhouse. You get to stay doing ultrasound and at a more advanced level. It's very akin to nurse practitioner or physician assistant, kind of like a mid-level between beginning ultrasonographer to radiologist, working in that spectrum. But honestly, I've never seen it come to fruition. I've heard a couple people that's their, they categorize themselves as that. Maybe in other countries, the ultrasonographer has more of a dictation portion to their job or report writing. At least in the United States, or at least in Florida, South Florida, where I'm from, we do the ultrasounds and we write a preliminary worksheet that's not really a dictation or a final report. There's our preliminary findings that most of the times the radiologists agree with and just dictate that, especially for the more seasoned sonographers. But I really never saw the ultrasound practitioner take off. I really wish it would. Other career opportunities would be management. If you're into that, I don't like that. I don't like managing people. I don't like having to order gel and things like that and have to be in endless meetings. I honestly would rather just do ultrasounds and scan. But that's a career opportunity for some people. Management. You may have to get a bachelor's for that to manage at the ultrasound level, and then at the radiology level, become a manager there if that's what you're into. And then you can just go back to school and follow further. You can go back and become a doctor, or you can become a nurse and then a nurse practitioner, or you become a physician assistant. I think, honestly, I don't know what the amount of physician assistants that have that skill, but I think a physician assistant that knows how to do ultrasound and can do POCUS or point of care ultrasound, I think that's impressive. I think that would be a very valuable physician assistant. All right, next question. What skills do you think are most valued in employees in this field? Okay, so as I said before, people skills are very important. You're working with people. It's very easy to forget that when we're just taking images and we're focusing on our images, and we may be dealing with people who are not too happy or actually kind of nasty. But people skills are very important. Critical thinking skills, because sometimes you're going to be finding some imaging that you may not know what it is, and you may have to. You might be a night tech, and you might not have any coworkers or radiologists to question, and you might have to hit the books and really deduce from the person's symptoms what this diagnosis may be. I actually love that. So critical thinking skills. Another thing is creativity. Being a creative person, I think, is very important for ultrasound. I see people who can draw, who are photographers, who are musicians. I mean, obviously I'm a musician, but I also draw. They're drawn to this profession because you have to take diagnostically accurate images, but you also have to take aesthetically pleasing images. Now, yes, every patient you get is not going to be a candidate for a very perfect looking textbook ultrasound. But I also see a lot of people use that as an excuse, like, oh, I couldn't get good images, body habits, whatever. I couldn't get good images, gas. I mean, we've all done it. Pancreas not seen, do the gas. When you're real busy, you do the best you can with what you got. But every now and then you get that one patient and you're scanning and you're in there and you're like Bob Ross. You're like, and right here, I'm just going to place a happy little gallbladder. And you really get into that zone and you get some really nice pictures. And everybody's different, but there's some patients that just like they're photogenic on the outside, they're photogenic on the inside. And you get really good images. And I think having that, everybody's, when you're a sonographer, you may get a call one time from a radiologist like, hey, I wanted to tell you these images were really nice. And that feels good because you're like, wow, not only did I do my job that I'm supposed to do, but I did it at a different level. And I had images that may be in a textbook. I'm always saving images of weird pathology or even common pathology that I just think it's a very good example of that pathology or of that normal anatomy just because it's so beautiful. And when you can see the beauty in that, that just shows you that you're creative. So I think creativity is very important. You would think that, healthcare is not really for creative people, but I think creative people can excel in healthcare when they can use their creativity as a tool amongst the other critical thinking and analytical skills. All right, next question. What are your typical work hours? As with most healthcare jobs, it varies. You can work a 9 to 5, just like a banker. You can work a 9 to 5 with call or 9 to 5 without call. You can work 312s, 410s. I've done pretty much every shift there is to do. I've worked 410s, 312s, weekends only. Right now, I'm on night shift. For the last 5-6 years, I've been a night shift exclusively. I work 312s at night. So, I mean, hospitals are open 24 hours a day. So, any shift you can get there. You can be part-time, per diem, full-time, on call only. When I first started, I used to take call only. There's just so many types of hours you can get, which is very flexible. And it's very good for many people who have kids, who have other things. Maybe they're just going to school for something else. Who knows? So, the work hours are very, very different depending on where you work, whether you're working in a hospital, in a clinic. If you're working like in an outpatient center or a clinic, you're going to work more regular hours. You may or may not have to take call. In a hospital, you may have to take call. Sometimes there's always some techs that prefer to take the call of other people. You know, it's very variable. It's not stringent at all. Next question. Are special licenses or certifications required? Yes. For ultrasound, there's many licenses. You have the ARDMS, which is the American Registry of Diagnostic Medical Sonographers. They offer the RDMS, which is a registered diagnostic medical sonographer, which has specialties in abdomen general. Abdomen in general is pretty much anything abdominal, including the scrotum, including the thyroid, some musculoskeletal stuff. You know, back then they didn't have a musculoskeletal license, now they do. Then you have OBGYN, which is pretty self-explanatory. You're doing obstetrics ultrasound, gynecological ultrasound, so anything obstetrical, anything fetal, baby, anything gynecological, uterus, ovaries, sonohysterographies, that's a license. Then the next registry is musculoskeletal. It's one of the newer ones. There's like maybe 200, 300 people that have it, I think, last time I checked. That's one of the ones I'm going to be getting. I also want to learn more and incorporate more musculoskeletal learning into the Facebook and YouTube channels. There's pediatric, which I just did a full review on pediatric registry review. Then there's RVT, which is registered vascular technology, which I also have. And then there's also RDCS, or registered diagnostic cardiac sonographer. So that's for echo, which has adult, pediatric, and fetal, if I'm not mistaken. This is from the top of my head. There's also CCI, Cardiovascular Credentialing Incorporated. They have their version of the echocardiography license, which I think is RCS, and they have their version of the vascular license, which is RVS, I think. And also the ARRT, or the American Registry of Radiology Technologists, also has ultrasound licenses. Off the top of my head, I don't remember which ones. I may put a list in the final edit of the video so you can see those. Next question, what is the salary range? And I'm gonna have to Google because it's so different in every state. In South Florida, I make $37 an hour. Which to some people may sound a lot, and to other people may not sound that much. Cost of living in South Florida, Miami is high. So let's say, for instance, you live in New York, California, you might make more an hour, but the cost of living is even higher. So that's something to consider. Here on Google, ultrasound salary range $64,000 to $92,000 an hour for an ultrasound tech 2. So that's an ultrasound with experience. It all depends on how much you want to work, honestly. I know sonographers that make $100,000 plus a year, but they work a lot of hours. A lot of hours. I don't like to work a lot of hours. I would like to work a little bit and relax. So you just gotta search your area. You might get pay $20 starting, but the cost of living is nothing where you live. So that's something to take into consideration. All right. Next question. All right. And this is the last question. Do you have any advice for someone who may be interested in this career? Anytime somebody asks me, should they go into it? I always tell them, do you like medicine? Do you like dealing with people? Are you able to see sick people? A lot of people are like, oh, I want to do ultrasound because I can't stand blood. You're going to see blood in ultrasound. You're going to have to scan people with gunshot wounds sometimes. You're going to have to scan people with stab wounds. You're going to have to scan people who have just gotten out of surgery. You're going to have to be in ICUs. If you work in a hospital, of course, naturally. If you work in an outpatient center, you might not see the acuity you see in a hospital, but you're still going to see people that just recently had surgery. You might have to scan somebody that has a wound. Before they go to the hospital, they might do an ultrasound there. So, are you squirmish with blood? Some ultrasound, many places is called to surgery, and you have to help. Either take the images, and sometimes you may even have to scan yourself on an open human body. You have to be able to be okay with that. I am, and people I work with are. And also, are you okay working with people? Do you like just generally working with people? Do you prefer to work in like a cubicle by yourself or in a studio by yourself doing your own job in your own mind, or do you like working with other people, where what you create has to do with other people? That's something to consider. Another thing to consider is thinking outside the box. It's so easy to become regimented in your thinking with anything. You think, okay, for this exam I have to use this probe, I have to use that preset, I have to use that megahertz, and I have to take those pictures. But nothing in life is that perfect. Every patient's different. Some people's livers are super high. You have to accommodate for that. Let's say, for instance, you're doing OB ultrasound, right? Super skinny patient, OB ultrasound, and you're having trouble seeing something because it's too close to the near field and it's kind of blurry. It's not in that great zone for ultrasound image. All right, the camera dead again. So I'm gonna finish this up real quick. So as I was saying, you're doing an OB patient, skinny. Who's to say you can't use a 9L or a linear vascular probe? Just because it's a vascular probe doesn't mean you can only use it for vascular. You use it for pediatrics and kidneys. Whatever you do, just think outside the box. Always try to be creative. Try to make the best case you can, the best diagnosis you can. And it's not only going to help you, it's not only going to give you pride in what you do, but it's going to help the people that's really our job. It sometimes feels like we are working in a factory where it's just one patient after another, and we're just factory workers. I know it feels like that. I've been burned out before. I've been there. But by being creative, by trying to keep it fresh, that's how we keep ourselves from burnout, and we keep ourselves keeping pride in our work. Vacations help too. So take vacations. So that's pretty much it. That's the last question. I responded to the person who asked me on Facebook. It was an ultrasound student. I'm glad she asked those questions. I thought they were very good questions. Hope this helps anybody who's thinking about or just starting out in their ultrasound career. As always, click the subscribe button, hit the like button, and the little notification bell if you can too as well. I'll appreciate it. And you can follow Sonographic Tendencies on Facebook and on Instagram. All right? Take care.